probably about a year ago now, I responded to an advert which was to look at having a public health base or a local authority public health based person help to increase research in local authority. Now, as a trainee in public health, I'd spent a long time getting involved in little pieces of research and really enjoyed it and thought, oh, once I get to be a consultant, I'll be doing this all the time. And the reality was very, very different. And so when I saw the advert, it absolutely spoke to me as this is what I need to be doing. This advert is made for someone like me. And I began to speak to other people in local authorities and ask them, well, why are you not potentially doing as much research as you used to do before? And came up with a lot of quite interesting responses. And the more I spoke to people, the more obvious it was to me that what we really needed was some way of joining, as it were, academia with those of us working in public health so that we could really start to explore those opportunities. So I absolutely put myself forward for the job, and I'm currently working probably about 4 hours a week in theory, looking to build that work. And for me, it's very clear that that should be done through the creation of a network. What's really interesting is that NIHR has provided us with a lot of opportunity to really build some sort of solid foundations around that. So they're fully in support of us developing a network. And I know I've spoken to quite a number of people who are here today, expanding on this idea of can we create this network across Cheshire and Merseyside. And I think the overwhelming number of people who've signed up for today's event tells me that it's a good idea. So what we want to do today is actually explore some of the existing research that's taken place, not locally, but regionally and across the country, to understand if that actually matches our perception or our experience here. And then we want to go on a little bit further on to actually talk about what our network should look like. The one other thing that I do need to bring to your attention is probably about a couple of weeks ago now, some of you will have been involved in a flurry of activity around supporting the development of what's called the Health Determinants Research Collaboration. So what we've done is we have, as a group of interested individuals, got together and put in an expression of interest or bid to form one of these HDRCs. It's by no means cut in stone that we will become a HDRC, but I wanted you all to be aware that that's actually presented itself again as an opportunity from NIHR to provide funding to allow us to form a collaborative if we're successful in our bid. So that piece of work has already taken place in terms of putting the bid forward, and potentially by us creating a strong network, we'd have a very firm foundation on which to build should we find out that we were successful in that bid. I'm going to stop talking now because I can talk for England. I'm really excited by the opportunities that today involves, and I look forward to speaking to people in whichever breakout group I get landed in. So I'm going to pass back to Mari. Thank you and welcome everybody.
Thank you, Ifeoma. So just before I ask you to put into chat why you're excited, although you can start doing that now if you'd like to, what do you want to get out of today? 3 things. We're going to have 3 sessions today. Each session will be started off by a speaker who introduces the subject and explains to us what their thinking is. And then you'll go into breakout groups. And there's going to be 3 breakout groups. The first one will take the research that's been done nationally and then bring it home to us and say, does this apply to us in Cheshire and Merseyside? What do we think of this? So you'll have a breakout conversation on some of the barriers that have been identified. Second session, we're going to split you into public health teams and 2 academic teams, very loosely split you, and just get you to have a conversation about what you bring to the table as that profession and what you need from each other. So it'll be that's really about how do we work together really well to create effective research. And then finally, we're going to go into some of the detail that Ifeoma was just talking about, really around what sort of network would we be, whether we're successful or not for the application for the bid for the money, whether we're successful or not, what would we be like? Okay, so 3 sessions, each introduced by a speaker, and each session will be facilitated by somebody who will say who they are as a facilitator when you go into the breakout room. Very brief feedback from each session, but feedback that will be shared later in more detail. So I'm going to move on now, and our first speaker to introduce the session around a session that's going to review the barriers to public health research and how accurate they are for us is Nia. So I'm going to hand over to you, Nia, to take us through.
Thanks, Mary. And thanks everyone for joining us today. It's great to see so many people here. So yeah, I'm just going to give you a little bit more of a background about, I know Ifeoma's already generally sort of introduced why she was interested, but I guess a bit more background about how we've got to this. Sorry, can I just go back to the first slide? Is it preempting me there, talking about the background? I was just going to just to say, so I'm Nia Coupe. I'm a researcher based at Lancaster University part of the time and funded by the Clinical Research Network. I've been working closely with Ifeoma over the last few months, and also in collaboration with Jen, who's actually a professor now of metabolic medicine at Lancaster, and is the Deputy Clinical Director of the CRM. Okay, next slide, please. Great. So I know most of you are going to be really familiar with all this, but just to make sure we're all starting on the same page. So we know that widening health inequality suggests there's a need to shift this balance from acute treatment of illness, that the sort of model that we currently have, to more of a preventative approach, particularly targeting those who need it the most. So sort of certain communities, people of certain backgrounds. And I guess that's referring a lot to all this, Michael Marmot's great work there about the wider determinants of health. I know since 2013, local authorities have been responsible for improving local population health, so they're really well placed to tackle these wider determinants of health. And a lot of you are involved in these services, so you know that you're sort of delivering services to tackle health inequalities and improve well-being. And we know this really requires rapid and relevant evidence to inform services. We also know that lots of local authorities would really like to conduct more research, like Ifeoma said, is something that she was hoping to do more and then has probably not done as much as she anticipated. And this is often due to the lack of resources and time and expertise in local authorities. Next slide, please. So the National Institute for Health Research, again, a lot of you will be familiar with this, but for those who aren't, it's the NIHR is a major funder of health research. So it puts out regular calls for research, for people to apply for the money to do these pieces of work. But quite often they're very clinical, they're not always suitable for local authorities to apply. In response to this, they have been putting a lot more money, into more public health-based research, and the NIHR Public Health Research, which is a sort of a section of the NIHR, launched a funding call last year in 2020. I believe this was pre-pandemic. They launched this call for local authorities to apply, and the aim of this was for them to explore how current or new systems could be developed at a local level to support sustainable and influential research activity. So they awarded up to £50,000 to each one of these, I think 14 sites we've got here at the bottom. So that was the aim of that work then obviously was to look at what sort of research was already happening at these levels, what the barriers or challenges were to these happening, and thinking about ways forward in terms of addressing these. Okay, next slide, please. So, sorry, can I just stay on the summary slide for 1 second? So the NIHR have provided an overview of the 14 reports that were provided from this work. So it was a range of work. They all had quite different methods. So they either sent out surveys, or they did quite a lot of qualitative work, so interviewing people in local authorities or within academics within higher education institutions. So they provided a summary which I'm going to talk through. So this isn't our work, although Ifeoma and I have been working on these findings as well. So next slide, please. So this first slide are the 4 barriers that they identified. So these were barriers which came out of all the reports, and are specifically about the ones that are external to local authorities. And these are the ones we're going to be thinking about in our next activity, like Mary said. So you'll notice as well from those 14 sites that Cheshire and Merseyside wasn't in there. Again, Ifeoma and Mary both suggested that all this work's been done more nationally. I think they're all England and Wales, but none of them specifically in Cheshire and Merseyside. So if you can bear that in mind while I'm going through these barriers and thinking about how they might apply to Cheshire and Merseyside or what might be missing, that would be really useful. So the first barrier here was that academia and local authorities often have different priorities. So they identified that academics are unsure how to anticipate local authority needs. Also that local authorities contributed to academic research a lot. So there's a lot of contributions, but not necessarily collaboration. So it wasn't generally a two-way process, and local authorities didn't always find out what the findings were. And on that note, local authorities also have, where there was sort of pockets of work going on, but it was quite ad hoc. There wasn't a sort of something that happened consistently within and across local authorities. The other thing that comes out quite a lot when academics try and collaborate outside of academia actually is that the research process is too long. So they spend a lot of time on, for example, the applying for the funding, getting the ethics, getting staff who are usually project specific and not permanent. So this adds a lot of time to this process. And as I said before, the rapid turnaround of this kind of evaluation work that needs to be done in public health it sort of clashes with that process in academia. The next barrier is that NIHR infrastructure is not always suitable for local authorities to apply to. So I've already touched on this a little bit, but some local authorities have a limited understanding of the NIHR infrastructure. The infrastructure also covers a really large geography, so it's not always particularly relevant to sort of smaller local authorities. And also, as I've said, the infrastructure and the calls that go out are often very clinically focused, so tend to be less appropriate for public health needs. The next one is that the wider research funding opportunities aren't always suitable as well. So there's limited funding for things like intervention and support costs. Applying, again, is very time consuming and really complex, and staff in local authorities are often ineligible due to the limited research experience. So in academia, someone who is the principal investigator will often be able to show that they've successfully managed a larger trial before, or have a lot of experience in that area, which isn't necessarily going to be the case in local authorities. And also staff in local authority might lack skills to complete the applications. Actually, I think that applies to academics as well, because it's such a complex process to apply for these, and that's reflected in the fact that there's lots of support available. So things like the research design service and a lot of workshops that the NIHR put on. And the final one in terms of external barriers is the barriers to community engagement, which is something that's becoming increasingly important in research. So underrepresented communities can be hard to reach, and that's really important given these are the communities that are likely going to be affected by these wider determinants of health. Communities might not value traditional research or see it as relevant to them. So I think this something that's reported around this is that people in communities see research as something that happens in universities by academics in these ivory towers, and it doesn't apply to their everyday lives. It can also be really time consuming for communities to participate in research. That also has a knock-on effect for staff in terms of supporting them and paying them for their time. And there's also some reports that local communities may distrust researchers. On the next slide, please. Thank you. So as I said, so the previous four were external. These next four are the ones that are identified as internal to local authorities. So the first one is that lacking research systems and policy. So that lack of system to support that kind of regular research, to support the research partnerships. Again, research is often tied to projects or not roles, so meaning that staff don't necessarily see that as part of their role. Often it was reported that there were no systems for sharing research as well, so that meant that often certain types of research was being duplicated rather than shared. So it was not supported by any kind of network. And research, again, it was ad hoc and dependent on individuals who had connections. So it wasn't something that was happening regularly. There was nothing in place to support that sort of regular work happening. It depended on whether somebody already had connections with someone in academia. Mixed research skills then is the next one, and this ties into the fact that there's a lack of sort of research culture quite often in local authorities. Some local authority staff don't know how to access or interpret research, so that's quite an important one. So the findings, although a lot of them showed that there was issues in terms of conducting research, they also identified this issue in terms of using research that's already published or that is being published. So not necessarily just not knowing how to access it, but there are also barriers in terms of paywalls, you're not being able to access particular journals, and then the skills that are required to interpret the findings and keep up with the findings as they come out. They identified that public health departments tend to have stronger research culture than other teams, so that's really good news for us. But there was a mixed understanding of what research is or what research looks like. The third one, that research isn't always prioritised by leadership. And again, this sort of taps into that fact that there's sort of lack of research culture that needs to be led from the top. It's not going to sort of start from the bottom up. So senior leadership don't always drive the research culture. There was also a lack of buy-in about importance of research from some senior leaders and councillors. And some councillors prefer local knowledge to research. So I think this is something that comes up quite a lot as well when you think about how sort of transferable or applicable findings are. So if there's been a big trial in London, it's not necessarily going to apply to or be the same or more useful than local knowledge, for example, in Cheshire and Merseyside. And then last but not least, this is something that comes up when there's any kind of new process or new behaviour that needs to happen. It was the limited time and resources. So there's limited time and resources to conduct research, so sort of the time and costs around applying for research, doing the research, and then all the work that happens after that in terms of implementing the findings. Again, communities might not value the traditional research, as I've already mentioned. Research also was, they reported that it wasn't prioritised compared to other activities within local authorities. Obviously, this in some cases will be justified if other work, you know, I'm sure over the last couple of years there's been a lot of other things that have been prioritised over research, but also that research sometimes was unanalysed. So because of limited resources, in some cases data had been collected, but they hadn't had the skills or the time to go back and analyse that. So it's sort of missed opportunity there. And next slide, please. So those are the main barriers that we're going to discuss next. So part of my role working with Ifeoma is about thinking about how to overcome these challenges and implement the findings, which is what we've started to do with this research network. But what's really important in research, and we know in implementing anything, is that we really need to understand the local context. So make sure it's relevant to Cheshire and Merseyside. So I'm going to hand you back over to Mary to start the breakout rooms for this session.
Lovely. Thank you so much, Nia, and for such a clear introduction to where we're at and some of the barriers that have been identified. You're going to work in breakout groups, and each group is going to look at a different barrier. So when you go into your room, you'll see that you're number 1 or you're number 2 or number 8, and your number will refer to that barrier that you're going to look at. Okay, so 8 barriers, 8 groups looking at the barriers. Okay, so and then there are 2 groups. We're having 10 breakout groups in total. 2 groups are not going to look at a specific barrier. They're going to look across the whole, more broadly, at all the barriers. And what we'd like you to do, we're heading here towards just clarity about where do we think we are now? How well are we doing? And if we can identify whether these barriers apply to us, then we can think about where we need to focus and improve in Cheshire and Merseyside. So depending which barrier or barriers you're looking at, think about, does this apply to us in Cheshire and Merseyside? Is it relevant? Are there different parts of the region where we can see this is true for us, and others where actually it isn't? And we've got examples of where, you know, this is absolutely not the case. So this is focusing on what isn't happening, but I think what might come out of is some of the things that you may disagree with and say, well, actually, we've got some really good evidence here to say this is happening. So try and make your conversation concrete and come up with examples. A lot of you in the chat have said you actually want some examples of things that are or aren't happening. Okay, so we're going to give you 15 minutes to have that conversation. Your facilitator will identify themselves when you go into the breakout room and guide you through the conversation, and they have this question with them, and we'll be recording the session, not to show more publicly, but so we can absolutely collect the information. Okay, so we'll put you into breakout rooms now and see you in 15 minutes. So I think you're back in the room. What I'm going to do is ask each facilitator in turn to just briefly, just literally a minute, comment on what your group said about that particular barrier. And while we do that, Ryan is going to record this visually for us, and we'll be able to have a look at what we've all said at the end. Okay, so the headlights, please, could I start with Helen, who's group 1, Helen Bromley, with barrier 1, academia, and local authorities often have different priorities. What did your group think?
Sorry. So yeah, So we had a small but perfectly formed group. So we had Andrew from the Wirral, Rachel from Cheshire East, Amy from the Zero Suicide Alliance, and Helen, who's a PhD student at the University of Liverpool. I have to hold my hand up, and it didn't have the option to record or have the meeting notes. So Ryan, you're going to get a load of typed up stuff from me later on. Apologies, and it's going to be like that for the rest of the day because the facilities are just not available. So we discussed the barriers and the different priorities between local authorities and academe. We touched on some of the challenges of connecting to different audiences and the purposes of the research, and sort of, it wasn't articulated as such, but it's how we turn research into usable products for local people, if you like. We talked about the differences within local authorities, about how receptive they may or may not be to academic approaches and engaging with local higher education institutes. We talked about academia. I think we probably agreed on this, is around informing. We see academia as informing our local priorities and helping us provide the evidence base. Tell me when to stop, Mari. We also discussed there's a sort of middle ground. So you've got the higher education institutes and what I would call hardcore academics, and you've got us jobbing service local authority people, but there's almost a layer in between. So you've got some really strong research units in UXA, formerly PHE, and other parts of the system that kind of straddle that hardcore academic with jobbing service. And we had a discussion a bit about where they fit in all of this, which is quite interesting.
Lovely. Thank you, Helen, and Group 1. Yeah, thank you ever so much. There's a lot in there, isn't there? We'll look forward to your notes. Thank you to the group. So I'm going to turn to Lucy now, who's looking at barrier 2, which was that the NIHR infrastructure is not always suitable for local authorities to actually apply for funding and other support. So Lucy.
Hi everyone. Yeah, so there was 5 of us in our group. We had Lisa from John Moores University, Layla from Merseyside, Roger from Active Cheshire, and Bianca from Merseyside and Life Rooms. And I think just thinking about kind of that first point underneath that, the second kind of section, that some local authorities have limited understanding of NIHR infrastructure. And the conversation that we had around that was that it's not necessarily a lack of understanding, but just that it's a very kind of complex structure, and that some teams, departments, services kind of fit in and work with certain elements of it, but that it can sometimes be confusing about how the different parts connect. So it can feel slightly confusing. Let's see. I think something that was noted as a real strength for the area, though, is how the directors of public health and CHAMPS kind of works collaboratively. So even where it does maybe feel like there's kind of different sections and different work happening, it does feel like that can kind of work across the whole of the area. So where there might be some differences, for example, you know, the amount of universities in Liverpool or the size of the area, it feels like there is that real collaboration across, so that can help with things feeling connected. The third point there about the NIHR being clinically focused and therefore maybe inappropriate for public health needs. There was a discussion about how it does feel like that is changing, and there's things like the Seldom Heard Voices Forum and lots of work happening to engage with communities. So it feels like there is kind of a shift happening there, and that it's going kind of that's going in the right direction. But there was a really good point about how maybe sometimes research can be, there's like an ideal way of doing research and a clear kind of start and finishing point, but local authority work doesn't necessarily fit within that kind of that ideal framework, and projects can be often kind of at various stages, you know, kind of through pieces of work, and so therefore it doesn't kind of always fit neatly into research, and how we might do that, the ideal way of doing that, if that makes sense. I think there are key points.
Lovely. Thank you to Lucy and the group. And if you've got thoughts, please do write them in chat, and we will be looking at those. And I noticed in the chat already, in relation to what Lucy and Helen have said, you've actually said we'd love to involve and hear from carers, the voluntary sector. We'd like to focus on different aspects of children's health or intellectual disability, or many ideas here that are reflected, I think, in what you've just said there, Lucy. So I'm going to turn now to Beth Milton, Group 3, Barrier 3. Wider research funding opportunities are not always available. Wider research funding. So, Beth, what did your group think?
So we had a really interesting discussion. I think one of the first points that was made was just around how sometimes the priorities of academics and the priorities of local public health teams just don't overlap. So with academics, there's typically that drive to carry out original research that's suitable for journal publication, whereas local public health teams are often concerned about the local, about what's relevant on the local patch, which isn't always the same. We also talked about potential disincentives to people who are just starting out on the research journey and who lack research experience. First of all, that funding opportunities can be very, very competitive, and that might put off people who've got less experience from applying. And also that need for an internal kind of organisational research infrastructure and mentoring. We had somebody in our group from Clatterbridge who's responsible for research infrastructure, and she talked about the really valuable role that she can provide in bringing researchers on, but often within local authorities. Typically, that's not something that's available. We also talked about how in local authorities, when interventions are being implemented, the focus is very much on the practical and not on the scientific. Sometimes people don't have access to evidence, so it's just not seeing things in terms necessarily of the science behind interventions. And then finally, that often it's just not on the radar of local authority staff to apply for research funding. People aren't aware of the sources of research funding, so it's just not on people's agendas really. Yeah, so that was us.
Lovely, thank you. Really, really helpful, Beth. So I'm going to turn to Sophie now, looking at barrier 4, which is barriers to community engagement.
Thanks, Mary. We had a really positive discussion, actually. I think we recognise that there are barriers that exist out there, but actually everyone in the group talked about positive things that they've taken away from their experiences, which was really fantastic with this. So we did talk about the fact that there's limited knowledge out there in the community about research and how it works and the different approaches that you can take. But we really talked about communication being key in engaging people and building those relationships with people, potentially ahead of time as well, not just in terms of we're doing this specific research, let's build relationships now. And on that communication front, talking about really continuing using paper and not just having everything online, and being able to reach those hard to or seldom heard groups. And then how we have the conversation as well in framing what the research is about, using the right language, and really thinking about how we match the approach we take in engaging communities with the type of research that we're doing, and thinking about, you know, sometimes using those qualitative measures that helps people tell their story and engages them in a slightly different way.
Thank you, Sophie, and thank you to your group 4. So group 5, Ifeoma, your barrier was lacking, it was an internal barrier, the first internal barrier, lacking research systems and policy. What did you make of this?
So, yeah, again, a really, really rich discussion among the participants. Very similar in many ways to what Sophie's just responded around communication, and a sort of a lack of real clear communication from academia into local authority and backwards in terms of who can actually get involved in research, who'd be interested. Do you have a specific sort of area that you're interested in, so that the academics can connect with you and say, come and do this piece of work with us. Also the fact that quite often, again, we totally agreed, public health is often the participant rather than the co-researcher, if you like. But we also moved on to talk about public participation and them having that same feeling that, hey, you know, don't just do the research on us, do the research with us. So again, there were other things we talked about, but I think those are the key things that really shone out for me. Thanks.
Thank you, Ifeoma, and the Group 5. So, Group 6, Paula Wheeler, mixed research skills.
Well, we had, again, a small but perfectly formed group of 3. We had one local authority colleague, Rachel, who absolutely agreed with the comments around the barriers about mixed research, where public health colleagues are seen as the experts in research and maybe to the detriment of other departments. There was also discussions about limited research skills, so where they had in other departments quite a lot of technical expertise, but weren't seen as generalists, so they might have expertise around tech or particular software packages, and it was thinking about how that can be generalised either across the local authority groups, or how they might sell that as an offer to working with academic partners. Andy, who's an academic, commented actually, and it was a really interesting insight to say, you know, absolutely academics want to think about how they best connect to local authority colleagues and how they might join and collaboratively apply to do research. But he was saying that from his perspective, often he receives calls that are absolutely fit for purpose for engagement with local authorities, but doesn't know who to contact. And gave an example actually that was basically a call from NIHR around public health research in housing and health, which would be of interest, I suspect, to quite a lot of local government staff, and basically had to do a round robin email that because he didn't know who to contact in his local area, and then went on to say that the potential for the research network could be fantastic in the area, because it would give you that space to make those, we've talked about connections, we've talked about communications. We also had Matthew on the call, who's from the third sector, and again offered some interesting insight where the third sector can often be that honest broker and third party between academic and research colleagues and local authorities, because there was suggesting that sometimes there's some sensitivities, there's some about what's in it for me. Academics often can't articulate what the research offer is. So, if local authorities haven't got time to sort of engage in lots of conversations and meetings, that there may be a third way around thinking about how we incorporate the role and the skill set that the third sector's got, that might often be doing research itself with academic colleagues, but also knows about the places that it operates in and might have links to local authority colleagues. I think that was it. Yeah.
Lovely, smashing. Thank you, Paula and Group 6. So, Nia Coupe, I'm going to turn to you now. Barrier 7, Nia.
Hi.
Research isn't always prioritised by leadership. What have you got to say?
So we haven't got a lot to say on that particular topic. So we had a group of academics, and the barrier that we were supposed to discuss was more about leadership within public health, I think. So we talked a little bit. We had Selena, who was I think public involvement lead in ARC Northwest Coast. Zena, I think, sorry if I pronounced that wrong, is an RA in Liverpool, and Hazel, who is an academic at University of Chester. So we talked a little bit about some past experience of, I think it was Selena talked about previous work in Liverpool, where they'd been asked in academia to evaluate some interventions which had been rapidly run out at a local authority, and talked about the barriers to this, and in that they didn't really have enough time to evaluate it properly, but also the interventions that they were being asked to evaluate were often quite rushed and not necessarily, didn't have any information about the evidence base of the interventions. There's also some discussion around fitting in with political cycles, I guess, and politicians needing to be seen to be responsive, but sometimes use speed over evidence in terms of intervention. So that was quite an interesting discussion. And then given people's expertise, so the public involvement, and Hazel has got an interest in involving people with intellectual disabilities. We talked a bit more about the I think it was barrier 4 around involving communities in research. So there was some discussion around just find my notes. One barrier, so one of the barriers I talked about was the fact that local authority staff often contribute to research with academics, but don't necessarily sort of get the information at the end. And I think Selena said the same thing applies then for members of the community, where they often are asked to contribute, but then they don't necessarily hear back about what's happened. And also they have these really sort of short-lived, although they're exciting and very participatory groups, they're often quite short-lived because of the funding cycle. So you can get a really good community engagement, really good group, and then the funding ends and that kind of ends, and then they need to start again with the next piece of work. So that seems to be quite a big barrier then for this kind of ongoing, no rolling engagement with communities. It's always sort of smaller, short-term engagement that happens. And I think just before we left the group, Hazel was talking about opportunities to involve people with lived experience in, I think she was talking about research and teaching, but due to COVID, this hasn't happened yet. And then that was the end.
Lovely. That's plenty, even though it wasn't a focus on public health. Thank you so much. Group 8, Elizabeth Collins. So Elizabeth, you looked at barrier 8, which was about limited time and resources, the final barrier.
That's right. Thank you very much to Kathy, Gay and Emma who contributed to the discussion. So we agreed overall that yes, this is an issue in Cheshire and Merseyside, but we didn't think that it was exclusive to this area. And we talked about a few examples. So we talked about it from the academic perspective and some practical issues in terms of the time it takes to learn about a call, get ethical approval, discuss methodology and engage stakeholders. And then we talked about more of a community example. So for example, health equity audit cycles and, you know, the time it takes to make sure that we're engaging the right people, and particularly around seldom heard groups, for example. We also talked about some additional barriers that I think have been suggested, but perhaps not articulated or drawn out. So some of those included system issues and the need for organisational memory when there's a lot of churn around different organisations and who is responsible for what. I thought that was particularly important from the public health perspective. Also talked about the interlinked nature of all the barriers that were highlighted by Nia earlier. So although we can see how they all sit together, we thought it might be helpful to really articulate that interlinked nature. And also another barrier that we discussed was artificial separation of organisations for informing policy. So really making sure that the research is something that's used to inform future work.
Lovely, thank you, Elizabeth, and your group, and thank you, because I think you've led us on to what groups 9 and 10 are going to think about. Thank you. So group 9, Julia, you were the facilitator, and I think you're going to broadly look, as group 8 just started to, about some of the overarching barriers, or what you see as missing across the whole.
Yeah, I think we certainly we had a perfectly formed group of 5 of us, really. I think some of the things you've already sort of touched on, we talked about, but there were such things as overarching the fact that the speak from an NIHR perspective can be quite prohibitive. It can be very clinically sort of focused and written, and it doesn't really seem to fit into the sort of the general sort of ask and the, you know, things like that. Somebody talked about the fact that quite often research tends to follow the person, we had somebody from Clatterbridge who talked about research following the patient, not really being designed by the, you know, professional, the academic, and really there was a lack of co-production really for a lot of the activity that goes on around that sort of design elements. And then Laurie, I think, touched on some of the elements of trying to, the barriers to sort of that community engagement and how that can be really difficult, and how really there is still, you know, a large component of general public and sort of clinical and public health professionals and HEIs that still see research as, you know, the guinea pig and that kind of approach really, and the need to almost normalise it, and how this might be a key opportunity for us to really utilise experience with COVID and what we've learned very quickly with COVID and the impact on COVID, to try and change that mindset. So it's a bit of a mixed bag, because we spent quite a lot of time trying to get the 8 areas up on screen, really, so we could focus down. But yes, some good discussion, I thought. Thank you.
Yeah, thank you very much, Julia, and big ask to look across. So thank you, Group 9. Group 10, you did similarly. Is there anything that Group 9 didn't say that you heard when you looked, Hannah?
Thanks, Mary. So yeah, there was a few things that we mentioned that perhaps haven't been picked up on that I'll focus on. So one of them around barriers to community engagement. So generally, we all felt that the internal and external barriers provided a good overview. But in particular, in terms of those external barriers to local authorities, we talked about the communities being hard to reach, and actually, is it just that we need to do more to reach them? And Pallavi talked about the excellent resources that we have and links with our communities in Liverpool. And again, learning from a lot of the excellent work that happened during COVID, and maybe looking at how we can better use that and apply that through a research lens. In terms of relationships, that was also an interesting one. And we talked about how often local authorities might apply for research funding, but then commission it out to a private company rather than a university. So again, perhaps missing that opportunity to build links with academia. And Kirsty, really interestingly, from Cheshire East, from their public health team, picked up on the point about research often being quite ad hoc and dependent on who you know. And she sort of talked about the fact that they don't have a university in Cheshire East within the borough, and kind of highlights that barrier around ad hoc engagement being dependent on connections. And then internally, barriers very much again around a lack of time and resource. So this idea that research isn't embedded because it's seen as an extra and a bonus, and it's not prioritised. People are already so busy and firefighting that it can be hard to get buy-in, and talks about experiences where small teams have to choose quickly what they can do, so they pick the things that they can do quickly, even though it might not necessarily be exactly what they want to do. And then talked about the kind of almost the disalignment in terms of commissioning and planning. So often councils have long-term plans, but commissioning cycles can be very short. So, often research is needed to go on for a longer period, and the red tape and bureaucracy that kind of comes along with research that can make it very difficult to actually get the buy-in and commitment to it.
Lovely. Thank you very much indeed, Hannah, and thank you to you all. Just before we send you off for a cup of tea, I'm going to share my screen very briefly, and then get Ifeoma to have a word with us and see what she's seen. So what I saw is, barriers are slightly a deficit sort of model, aren't they? And we knew that when we started this conversation. But what I've heard is that you've really got underneath in your groups and really thought about what they mean in Cheshire and Merseyside. But you've also turned them to the positives. I heard so many ideas about what you can do in Cheshire and Merseyside to address this barrier, or the barriers across the piece. So that tells us, I think, that there's a real will to do this work together. And as much as the what you do and where you focus, what I was hearing is that there's something about the how. How do we make this work together? How do we build those relationships, not just public health and academia, but with health, with the voluntary sector, and in particular with people and communities, so that their voice is well and truly part of, and they co-design and do it with us. Ifeoma, do you want to just sum up your thinking before we have a break?
Yeah, one of the things that I found really quite interesting, and I was waiting for it, was to hear the word COVID. Now, it didn't actually make an ugly appearance, I think. I certainly didn't mention it in my group, although the word did come up. I think it was around about group 6 or so when we started to hear the word COVID more and more. What's interesting and why I pick up on that is because in my group, and certainly things that I've noticed back where I work, is that COVID suddenly concentrated us and made us actually start to do things that for many, many years we'd put off and said we couldn't do. Typical examples being the creation of the Cypher dashboard that many of you may be using or have seen. The other thing that COVID did is it started to bring together partners who've never necessarily worked together before. It made us certainly engage more with our local academic partners in terms of evaluating some of the pieces of work that we did in relation to COVID. So I found it quite interesting that COVID wasn't mentioned by absolutely every group. The other thing that I think I've heard a lot more of, and perhaps as a system we need to think about, is public involvement. I think that in my mind, certainly in thinking about creating the network, I've been very, very focused on linking academia in with public health teams. But absolutely, I think it's also really important to think about wider partners when we do this. So I think today's session already has been really useful for flagging that up to me. So thank you for that.
Thank you very much, Ifeoma. And in front of you, you can see how Ryan's recorded everything that we've said. So nothing's going to be lost from the conversation. Thank you very much, Ryan. So what I'd like you to do now is have a break for 10 minutes, literally come back at 20 past, have a cup of tea, have a move around, and then we'll spend another hour and 10 minutes and have two further conversations. So please don't go offline. Absolutely stay inside the room, and we'll see you in 10 minutes time. Thank you very much indeed. Welcome back, everybody. Hope you had a good cup of tea and a break from the screen, moved around a bit. So carrying on from where we left off, having thought about what the future might hold for us in Cheshire and Merseyside, we're now going to think about how, as professionals, and I think with community, how might we actually work together differently and understand each other's perspectives. And to speak before we do that and give us a flavour and some thoughts are Julie Mugarza and Roberto Vivancos. So between you, we look forward to hearing from you. Let's listen.
Fabulous. That's great. Thank you very much, Mary. So hi everybody. My name is Julie Mugarza. I'm the Research Delivery Manager for the local clinical research network, which is one of 15 networks in England and is part, obviously, of the NIHR. Obviously, I think so. Ifeoma and Jen and Nia's funding is from the NIHR. So that call that came out was for all 15 networks to build that first point of contact and sort of first opportunity to understand the landscape of public health research. Over to the next slide. Thanks, Tracy. So I suppose one of the real challenges has been, I think, so the clinical research networks have been around for 15 years. And they have always been very clinically focused up until a number of years ago, really, where the penny dropped that there needed to be more upstream thinking, really. And I think at that point in time, specialty leads for public health were recruited, and Roberto is our specialty lead for public health. I think we still have a network that is called clinical, and that's why I put in the title clinical in small letters. I think that there is a tide of change and there is a tide of opportunity, I think. Certainly the lead for the sort of NIHR, William Van Toff, is very much around us doing a lot more public health research and us really doing some upstream thinking. Our budget in North West Coast of 17 million predominantly goes into secondary care, but I think that will be very different in the next few years. From a network perspective, I suppose, you know, I'm trying to think of ways that we can sell ourselves. And I think, you know, we have a humongous, you know, largest experienced research infrastructure in the world. It's held in highest esteem, and that's been never more obvious than in the last sort of 20 months around COVID, and how that call to action has really demonstrated some of the world-class research that has gone on and the vaccines that we now have available. We can access, and for public health, we can access an infrastructure of support from concept to delivery. So we work with the system to help and design research, and that's where certainly from a public health perspective and our National Public Health Lead Jane West, we're really keen to work with local authorities and with the infrastructure to build and support research at grassroots level, you know, and I think that's really important. To get studies on portfolio, public health portfolio, there's lots of ways you can do that, but to do if you do that, you're able to access funding, and I think that's what is really important. That 17 million we can move around dependent on research, so I think it's really important to link with the network as early as possible when people are designing research. And I think one of the things what somebody mentioned earlier is around the comms. I get public health studies through, but I'm really not sure who to send them to. It's a huge infrastructure, and I sort of scratch my head, and we sit here in Liverpool scratching our head thinking, well, who do we know who might have those contacts? And I think there's lots of missed opportunity for research that might be of interest to this population. We have lots of contacts, so I link in England wide. So if you have a study in public health that you want to set up, you know, I link in with lots of HEIs, lots of other networks, and I have lots of contacts in public health. So that's one of the reasons why it's really good to link in with ourselves. And I think it's just really important. You know, we have I think Nia highlighted, you know, there is national training available for people who want to do research that is really, you know, sort of high quality and things. So there's lots of positives of why we should work collaboratively together. Thanks very much, Tracy. So this was just a quick flavour, because I think most probably more importantly, Roberta's going to hit on 4 studies in a minute, but I just pulled some data from our public health recruitment. Now this is just in North West Coast, and these were sort of studies over the last sort of 2 or 3 years, and this is well, you know, obviously the Virus Watch was a study sort of looking at the spread of COVID in households. It recruited, you know, sort of 24,000 households, 57,000 people into that, and has really helped us to understand that as a you know, as a major public health challenge. Roberto is going to touch on Epicrypt in a minute, so I won't talk on about that. PALS was a study a couple of years ago looking at loneliness and isolation. And was sort of comparing sort of a Genie approach to usual care, utilising an app for people who were really socially isolated, and has published since and things. The Reflective Fostering Programme was a package of education support for carers of people who foster carers and things. So there is definitely public health research out there. I think a lot of it is badged under other specialties, which I think was touched upon in the early part of the discussion, I think. But I think the opportunities are there. The opportunities are there to fund public health research. Thanks very much. Next slide. And this is just, I just gave a quick national, you know, these are the networks at the bottom of this bar chart. As you can see, there's some very large recruiters, but they're COVID questionnaire studies that were done purely in North Thames. There's a little bit of game playing with numbers sometimes by some of the networks, but there is a varied portfolio. There's a varied opportunity. You know, I think it's quite an exciting time. I think from my perspective, supporting public health and leading on public health for the network, it's about, you know, when we have calls that come out, who are the key players that I need to share that call with, and how can we support? You know, one of the obstacles was it can be too complicated to put in bids, or we have an infrastructure of support to assist people. We have funded this year academics to design and backfill their time to give them time out to design studies. So I think the opportunities are there. It's just how we can do it and how we can, as a collective, work together to enable that to happen. Thanks very much, Tracy. And these were just a couple of examples of local collaboration. I think there is it was touched upon earlier, there's lots of pockets of research happening. They most probably go under the radar of the NIHR because they are not on portfolio. So I chatted with Helen a couple of nights ago because I know she's doing some great stuff in Cheshire West with Lancaster University, and they're linking in with the sort of the age-friendly borough and the Ageing Well Centre at Chester University. They've done one of the largest public health baseline studies, looking at things like transport, housing, access to leisure, etc. And that's a 5-year programme of work. But that, you know, it's only because I chatted with Helen on the phone that I'm aware of that is happening. And what's interesting is actually there's most probably lots of opportunities of this kind of thing, and us trying to get things funded on the NIHR portfolio would be really good. She talked about, Helen, who's obviously on the call, and one of the facilitators talked about, and apologies, Helen, if there's some misinterpretation here and things, but you talked about that sort of independent evaluation of COVID testing, contact tracing, outbreak response, and how that's going to inform, you know, our current challenges and things like that. So I think there's lots of pockets of really good, positive universities, local authorities working together. And as a network, we're really keen to feed into that and to support that and things. And there's potentially bids around homelessness, gaps in adult social care, which has never been more obvious than in COVID times, really. I've just captured there, you know, we've had a 20-month response to urgent public health studies, and we've had local authorities, Liverpool School of Tropical Medicine, the network working together to get these types of studies. So RAPTA, which was the diagnostic study that has really helped us, you know, with our PCR testing and our lateral flow testing and things like that. You know, Liverpool, Cheshire and Mersey, you know, a flagship in some of this work, and that collaboration of universities and local authorities working together, public health directors really supporting that research moving forward. And Agile again is a study looking at antivirals. We're just about to open one of the largest antiviral platform studies, which again we will need support from a local authority perspective. And then Professor Penbar received a £600,000 grant from the NIHR to look at building back post-COVID better. Again, lots of work, University of Liverpool, UCLan, and that kind of structure to really maximise on the opportunities of Cheshire and Mersey in the Northwest region, really, to really flagship the key opportunities that exist. Over to you, Roberto, I think, for the next slide, if that's okay, and I'll put myself on mute.
Yeah, that's all right. I'll try to be brief. I know we're just going a little bit over time. These are examples of studies that the network has supported over the, well, I was going to say over the last couple of years, but over the last couple of years we've had COVID. So it was probably in the run up to the pandemic that I started working as the specialty research lead for public health. I'm not an academic. I don't have an academic background. I'm a frontline consultant in public health. I mainly work in epidemiology, and some of you may know me as epidemiology from PHE and now Health Security Agency. And I mean, when I started, a lot of the projects that were coming to the network, if they were public health related, we're going to other specialties. So some of these probably would have ended up with infectious diseases. The University of Liverpool and PHE were awarded 2 health protection research units in 2016 or 14, I can't remember, a long time ago. And some of what we've done is been able to support these studies. So, for example, the E. coli study in the community, the network has supported with putting together, helping with developing the protocol, making contacts with clinical networks, because it's recruiting or aiming to recruit cases in hospital, community-acquired cases, and also patients or people in the community to use as control. So we've been able to support with that. I mean, EpiCrypt also access support for the protocol development, but also recruitment. The changes study, I mean, that one in particular proved a bit of a challenge for the network, in that the network traditionally had not worked with community settings like care homes, and perhaps it's one of the reasons why people don't in public health don't access the network, because they're thinking, well, I'm recruiting from the community at large. The clinical network probably won't be able to help me. We are changing, and the network is expanding into public health, in supporting public health, working with local authorities, frontline research, and yeah, if it means approaching care homes and so on and tapping onto new networks, we will do that. And then we did that with the change study, which just looked at in infectious intestinal disease in nursing homes. And then others were helping to recruit GPs to interview them about how they approach a case presenting with signs of Lyme disease. This was to understand some of the coding of primary care when people see a Lyme disease case, and then applying that onto surveillance systems. So I guess the bottom line is, and we did just before COVID, we did with Anna Donaldson, who was a specialist trainee at the time. We did a survey of those in public health, academics and non-academics, about their knowledge or involvement in research and knowledge of the network. And by and large, what we've got is that people don't relate the clinical network as something that could help them. So I guess the take-home message is that we can provide quite a lot of advice. I mean, as I say, my less well-known role is specialty research lead for public health in the network, and I'm always happy to speak with people about their interest in research and point them in the right direction, discuss with them what might be available from the network to support them in terms of training, protocol development, accessing funding, grant applications, that sort of things. But if the network cannot provide it, as I say, as a person interested in frontline research, I'm always happy to chat with people and point them in the right direction.
Thank you. Thank you very much indeed. I'm sure there'll be a big clap and a raise of hands to you both, Julie and Roberto. Thank you ever so much. Really helpful. And I think that sets us up really well for the second conversation that we're going to have. So we've heard lots of examples of really good research happening in the region, in pockets, but things that are really making a difference to us. And Hazel's comment in the chat about, yeah, agreeing it doesn't have to be slow, but we do need to collaborate to make this work. So I think thank you for that comment, Hazel. So what we're going to do is actually get you now to think about not what research should we do, but how should we do it together, and what would it look like, that collaboration. And before we even go into collaboration, we want to take a step back from that and think about what different professions, different disciplines can bring to the table that we need to really appreciate and value about each other. So to do that, we have split off one group of academics that Nia and Julia are going to facilitate. So there's about 9 of you in total who are purely from an academic background, if there is such a thing, and I'm not sure there is really. And then the other groups, so in your group, what we'd like you to think about as academics is, what do you bring to the research table, and what's the edge that you have that perhaps others might not have, and what do you, but the flip side of that, what do you need from public health, BCS to do your very best work? Okay, so that's the groups, Nia and Julia's group. The other groups, of which Paula, Elizabeth and Hannah, you're actually from an academic background, but we'd like you, the other groups, to facilitate a conversation with which will have public health people in it. It will have from many different branches or aspects of public health. It'll have health colleagues, it'll have VCS colleagues. And we'd like you to have the conversation about, what do you bring? What's your value around research, and what do you need from your academic colleagues? So I think we're putting together some of the conversations that you had in the previous session about the opportunity. Okay, so when you've had that conversation for 5 minutes in your group, can you then turn to look at, given this is our strength and this is what we need, how can we work together? And start to sort of come out with some concrete things about the way we can do this together going forward. So Jenny's going to put us in groups. Facilitator, if you could identify yourself. So Paula, Elizabeth and Hannah, you'll have a mixed group. Groups 1 to 5, you will have a mixed group of public health, and BCS. So Jenny's sending us now. We'll give you 10 minutes to have those conversations, and then we'll come back together. We won't hear feedback from everybody. I'm just going to ask for feedback from Helen's group, which is group 1, and from Nia and Ifeoma. Okay, but please record it, and please write it down if you can. So see you in 10 minutes. I hope that was a helpful conversation in your groups. And what I'd like to do is just to really hear from Helen Bromley, group 1, about what sort of perspectives did you share about why you need, what you offer and why you need academia. What was the general view, Helen?
Okay, I'll keep it short. So we had Amy from Zero Suicide Alliance again, Rachel from Cheshire East again, myself and Rory McGill in on the conversation, which was really interesting because Rory and I both come from academic backgrounds in a former life, which is a nice crossover. And we looked at what we thought local authorities, what edge they had, what they brought to the table. And the key thing that was sort of unanimous amongst us was that actually local authorities are the gatekeepers to populations and local systems. So, you know, Rory gave the example of Clark. When we were part of Clark, and Cheshire West was part of that as well, you know, we were heavily relied on to access local populations, and Paula will remember that too. So that was one thing. We briefly touched on the stuff we've already covered in a previous session around relevance, time frame, and publication oriented, perhaps academic world, rather than actually improving the health of the population. I guess we also could all provide examples of really good pieces of local work, but because they weren't tagged to a higher education institute, they kind of got lost in the system or didn't have the kudos. That's something that an academic publication in, I don't know, the Lancet or the Journal of Public Health or wherever you want to shove it. So there was that sort of misalignment or disjoin or disconnect, if you like. I think local authorities are always interested in the so what. So sort of the policy recommendations, what actions. You've done a lovely bit of research. So what does that mean, and how do I translate that for local people who might not be familiar with research language terms? And then there's something for me around, and this sounds awful, I'm not sure how to articulate it well, but those of you who know me know I'm quite honest. I think there is something about a hierarchy of institutions in all of this, and how that pans out as well, because similar to really good pieces of work not being tagged by an HEI, sometimes there's a little bit of, it feels like perhaps there's a bit of tension perhaps in the system. It's a national thing, probably an international thing, around different institutions and where it all fits in the local picture. Sorry, I'm not articulating that well. It's not a criticism at all, it's just an observation. I'll stop there in the interest of time. Thanks.
Thank you to Helen and your group, Helen. And we actually asked you, Helen, because you straddled both disciplines or a wider perspective, and for your honesty. So we appreciate that and, you know, welcome it. So Ifeoma Onyia, I just wondered, would you just have a toss around a few ideas yourself based on what your group said and what you've just heard from Helen? What is it? How might that working relationship between the sectors and with people really develop in Cheshire and Merseyside? What's it going to look like if it's amazing? What do you both think?
I quite like the idea of it being amazing. It needs to be amazing, doesn't it? One of the things that resonated with the group that I spoke with in terms of some of my feelings coming into this was that, and it's really, Helen's picked it up quite well and articulated it, is the fact that we every day in public health use research approaches, research methodologies in doing what we do. But because we often don't publish it, or because we don't have academic titles ourselves, all that amazing work we do is lost. And there's actually, I think, a powerful opportunity for us here and now, but also a need to shift the perspective a little bit so that it is seen, if you like, in equal. We talk about parity of esteem, don't we? We need parity of esteem around public health research methodology. What do you think, Nia?
Yeah, so I was just sort of reflecting a bit on what was talked about in our group, and the fact that obviously everyone's really enthusiastic about this, but we may be slightly biased because the people who are joining us today are the ones who want this to kind of work going forwards. But something that, I mean, we talked mostly about the kind of what we can bring and what edge we've got, but the thing towards the end was that we need people to want to work with us and to inform us, which was one of the barriers that we picked up on, the fact we can't anticipate local authority needs. And we need to collaborate at all levels. But I think just before we got cut off, there was this thing that we can't really get over, is the lack of time in public. Like you say, Ifeoma, you know, you've got all this great work, but quite often, as well as sort of the lack of research, or the lack of time to publish, you know, we appreciate that don't necessarily have the time, and not quite sure how we address that really, other than some of the edge that we do have is that we can increase the strengthen the capacity through bringing our own research skills, and you know, the fact that almost like a SWOT analysis, we're experienced in research, so we can identify the opportunities and threats coming up, and almost that saves time in terms of, you know, thinking about what opportunities are available, what's the best way forwards, how can we get the best out of this piece of work.
Yeah, one of the things that I think is really fascinating about this is just for the mere fact that I'm, if you like, energized by all this. I wrote a whole list of things that I think we're doing in Halton Borough Council, but we need to be actually doing some, you know, writing it up, getting it into journals. And I said, look at all this. There's a whole raft of things I think we should be evaluating that we're not. And so I do think that there's something about, again, I believe it's something I've seen in the sidebar, about the need for, in every area, you need an energized person, a champion, or call it what you want, who can pod in, much like the Roberto role that was outlined to us, that keeps saying and reminding people, hey, absolutely, think about this, think about this. We absolutely need to be focusing on this, writing this up, etc., etc. So I'm really hopeful that by creating some sort of structural network type approach, we can actually have a systematic way in which we reach out to academia, they reach into us, and we start to have some of these conversations, not just ad hoc, which is a word I keep hearing, but absolutely regularly. I'm going to keep quiet now because I'm conscious of time. Mary, back to you.
Well, I think you're leading us into the final session, actually, Ifeoma, aren't you? I mean, you started to create what this amazing network might look like. Is there anything else you want to say before we go into our third group and really start to get underneath it a bit more?
So really briefly, I remember as, again, as a specialist registrar, getting involved in research, and it was absolutely very ad hoc the way I fell into it. But part of being on the Northwest Training Scheme meant that there was a very structural way in which you accessed academia, which is how I got into doing the research in the first place. So we used to have regular academic forums where we exchanged ideas. And yes, often it would be that we'd present a bit of a paper and have a discussion about what was in that paper. But wouldn't it be great if we actually started to have conversations like that about, well, these are all the potential pieces of research that we would like to do. Wouldn't it be great if, for example, if there was a set of MPH students coming in, that we started to have that early conversation about, hey, there's all these MPH students lined up. What would you guys like them to actually focus on? I think there's a whole raft of different opportunities. The last thing I would want to see a network doing is us all getting together and saying, yeah, let's sign off that proposal. I once sat on a nice guidance group, and all we did was say, you know, nice guidance, whatever. Has everybody seen it? Has everybody signed it on? Let's move on to the next one. It's not what I want us to be doing. I really want us to focus on some of the opportunities that have been outlined in the various conversations that we've had today, and for us to start to link together. So my understanding about the next session is where we actually start to put some of that, if you like, pull it all together and actually start to have a conversation about what would a network actually do for us? What would it look like? Who would run it, to actually start to make this real for all of us? So I'm open really to ideas and suggestions. What does this network need to be like for it to really work for us all? Thank you.
Lovely. Thank you, Ifeoma. So on that note, I don't need to say what you're going to do, because I think Ifeoma's really described it there. You are the energized people. You're here because you want to make this work. So go into your groups, and same facilitators, but you'll be randomly assigned to work with different people. What do you really want? What's your idea of this network, and how can you start to make it work together in the ways that Ifeoma's just described for you? Sophie Bird, I know you're going very shortly, Sophie, so we're not going to put you as a facilitator in a group. So we're just going to have 9 groups. Okay, so go into your groups, and we'll just hear from 1 or 2 when we come back. Okay, so 10 minutes in your group. Lovely. Great, thank you all for coming back. We're in our last 15 minutes. I think if you need to mute somebody, I think. Yeah, great, thank you. So just want to hear a couple of voices before we bring ourselves to a close. And first voice is, I'd like to hear from Lucy in group 2. Lucy, and then I'm going to ask Hannah in the final group 9. Lucy, what was the energy like? What do people want to do? And what's it going to look like?
Yeah, well, we didn't manage to make it through all of the different points, unfortunately, and I'm sorry, Julie, that it cut off just as you were about to say something that I'm sure would have been very, very interesting point. But we had, our main conversation really was around I suppose like getting the right people involved in this, and we were talking about how, you know, we can all say, oh yeah, this is a priority, or this is something that we should be doing, or something that we want to be involved in, but we need people to take part who've got the drive to that, and the energy, and maybe the capacity to actually take stuff forward. So we were having a bit of a chat about that, and saying about how in terms of people that are involved, it should be, we need to think about how the information and the connectivity filters down across the whole of the, you know, everyone in different teams. So it's not just about kind of having 1 or 2 people involved in this. We need to think about how people from different levels and in different roles engage in the network. We had a bit of a chat around governance as well, and Julie made the good point about kind of using what's already there. Let's not invent the wheel. If we've got kind of systems in place that we can build upon, then let's use that, and also look to other geographies to see what's already working in other areas, and what learning can we take from other places. I think they were probably the key points from our group.
Lovely, thank you, Lucy. Hannah, would you like to flag some key points from your team?
Yeah, sure. So
thank you.
We had some really, really good conversation. I think of the key things that we spoke about was that a hub or a network would need to be action focused. So yes, good to get together and discuss learning and good practice, but actually about how we can be proactive. One of the things that we talked about was around having that network look at the outcomes of research and being able to evidence the outcomes as well as focus on the development of research. So thinking about what impact has our research had and does our research have. We talked about yeah, great to have that opportunity to make research more accessible. Identity would need to be really important. We didn't come up with kind of a name of what we would call it, but the identity and how we define and describe it to others would need to be very distinct from other networks that we have that are available that provide support for research in the area. And then one of the things that we talked about was funding. So obviously that's one of the key things that we would need to have this work and have it kind of develop in terms of particularly from an academic perspective, and the time taken to do perhaps unfunded activity and that side of things. So just some of those logistical, practical issues. And then a couple of things that were mentioned around ideas of what the network could facilitate. So first of all, placements. So it could be that people have the opportunity to kind of cross over. So professionals working in different sectors could do a placement in a different area and just to see and live some of those barriers and challenges that we've all been describing today. That opportunity to see their day-to-day work, and then also having some kind of repository of information that lists the specialities that we have available to us across Cheshire and Merseyside, whether it's academic, whether it's voluntary sector, whether it's within the local authority, who does what. And so if you need support with something, you know exactly where to go to for it, and it's not, it kind of takes away from that ad hoc, you just go to who you know, and perhaps make it a little bit more equitable, but also you go into the person who's the expert rather than the person that might be kind of your friend from the institution down the road sort of thing. So I think they were probably some of the main things that we spoke about. I've missed lots of things off, but I've got loads of notes as well, Mary, so I'll share those.
Lovely, thank you, Hannah, and thank you, Lucy. I heard lots of nods as you were both speaking, so that's always good news, and that people are nodding now. So I'd like to thank you all as facilitators, because it's intensive to listen, record, and make sure everybody's voice is heard. So if we can put metaphorical claps for all of you facilitators this afternoon, that would be great. Thank you very much indeed, much appreciated. Thank you. So can you believe it? 2 hours ago, we were talking about barriers and things that could stop us in Cheshire and Merseyside from creating this research network, this hub, things that were preventing us being our very best version of ourselves. And yet, you've come around to looking at what's really possible, shared so many ideas, and, it feels like you're on the cusp of this network. It's already there, isn't it? But the relationships are there, but are really flying with all the ideas that you've shared today. So just a couple of things remaining to do really in the next 10 minutes. And the first is just to hear from Ifeoma about whether, any key things that you've heard, Ifeoma, or that you're taking away as next steps.
Yeah, thank you. Oh, gosh. You're right. I mean, 2 hours ago, we sort of were mulling over what's it going to be like. And I have to say that when we went into this last session, I was thinking, oh, my goodness, what happens if we don't get the things right that we need? And instead, there seems to be a wealth of ideas about what we need to do. What I've heard is that there's absolutely an interest in this, and one of the things that I find that's really exciting is that people keep saying to me, you need to speak to such a person, and I've either already spoken to them, or there's literally like within a few minutes there's going to be an email or a diary invite set up. And mostly, in fact, there's nobody that's attended today, I've been told to speak to, that some sort of discussion hasn't started, which suggests that my data is no, I'm joking there. I'm thinking back to when I did qualitative research, and yeah, okay, right. I was going to try and tell a really corny joke, but I saw Rory's face, and I'm going to stop now. Anyway, one of the things that's come through loud and clear is that there's definitely a place for this research network. There's definitely some gaps that need to be filled in terms of this sort of, I suppose, the gap that we've all described between academia and those of us that work in public health, but the gap's nowhere near perhaps as large as we thought it was. The network itself sounds like it needs to have a very clear and regular focus. It needs to meet regularly. It needs to serve multiple needs, and those needs need to be clearly elucidated at the beginning. But there's also a role for a much more dynamic feedback loop that needs to also take place, so that there is the ability for public health teams to access academics. And I would also push for a need for there to be a shift in thinking about research being something that happens simply within the halls of academia. It's something that happens on a daily basis within public health teams, and there's something about the need to facilitate public health teams to start to do that more. Next steps. So what we're hoping to do in March is actually formally launch the network. So that means that a lot of the work that has been done within today's workshop is about us sitting down and pulling together what that real network looks like. We asked you to come up with a name. I haven't heard any suggestions of a name, but that's something that we'll do as well. And then we will actually, as I say, we'll formally launch the network in March. It will be the case that we will be coming out to you to potentially firm up some of the issues that have been discussed here where we think perhaps there's still a bit of a gap. So things like frequency of meetings, where the meeting will hold. I think it's very clear to us at this point in time that we would need to have an online gathering, because nowhere we're going to be comfortable trying to meet face to face. I think for now I'm going to pause at this point, because what I'm really saying is that yes, we're going to formally launch the network, but there's some work that we still need to do in order for that to happen, and it could be that we will be coming out to you to gather a little bit of additional information to make that real. But thank you so much for everybody that's contributed today. It felt really buzzy and exciting for me sitting here listening to all the things that have been said about this. So thank you.
Thank you, Ifeoma. And so I think I might try and save you some of that going out and asking, Ifeoma. So what I'm going to do is ask everybody here, you all know how to use the chat. What is it that you could commit to or offer to do to take this network to the next step? So please just put yourself in there so that you come to Ifeoma, and then Nia and all those other people who are organising this network. What can you offer on the setup of the launch? So before you go, just and please don't go, because we've got just one other thing that we'd like to do in the last 2 minutes. So please let us know what you can put it in chat. What is it that you can do? And I'm still looking to see an idea here. And then I'm going to share it. The first one that I see, first commitment. Thank you, Paula. You're going to connect. You're going to do some connecting. Thank you. Anybody else going to do anything tangible? And Rafa. Okay, so while you're thinking and hopefully putting them in, what I'm going to ask Ryan to do is, it's really good to get a readout of how you're feeling, having been with us for 2.5 hours. And Ryan's going to do something that's called Mentee Meter, which I shall let Ryan describe to you. And this gauges how you're now feeling. So Ryan, talk us through this.
Yeah, sure thing. Thanks, Mari. So we've got something up on the screen called a Mentee Meter. So you'll see at the top, it says go to www.mentee.com and use the code 84776673. and then you can give us your 3 words to describe how you feel now about having a research hub in Cheshire and Merseyside. And then as your words come in, you'll see them start to appear on the screen. So I'll pop the code in the chat as well, and you should be able to use your laptop or your computer or your smartphone, whatever you have in front of you, to go to mentee.com and use that code.
And thank you, Ryan. This is really, really easy peasy to do. It's really intuitive, and you will see in a minute a delightful array of words, thoughts, feelings if we all do it, but it needs all of us to commit and have a go at this. There you go, look, isn't it amazing? Connected. Thank you all, and thank you because the commitments are still coming in as well, which is absolutely smashing. As you watch as the words come, and what we'll be doing is we will be writing up in some way and pulling out some of the highlights from today, and certainly using the ideas to plan forward, and you are part of that planning forward. So all your commitments will be coming back. Looking very positive, reassured, encouraged, practical, positive. Anybody else still to do it? And just finally, as you're finishing off, I'd like to thank Jenny for all the work that she's done to make the tech and get us into rooms so efficiently. Thank you, Jenny, and to Tracy for the work that she's done in support to get here today. And Ryan has been doing an amazing piece of work to pull together visually on a post-it note board everything that we've said in summary. So we won't share that with you this minute because it's quite small to see, but we'll make sure you get a copy, which will help you to see where your contribution's been recorded. Lots of offers in the chat here, Ifeoma. Great, and I think with 2 minutes to spare, I don't think we should keep you any longer, but you might want to wave goodbye to each other. Perhaps put the Mentee Meter down now, Ryan. Great. Thank you, Ryan. So goodbye, everybody, and thank you.
Thank you. Thanks a lot. Bye.
Thank you.
Thank you. Bye.
Thank you.
Thank you. Bye.